very pleasant evening, one and all present here. So welcome back again to our 21st session of 3-month training program. So I invite all the eminent personalities of WCOP, though they are not present here physically, and also will invite the chairperson or the chairperson of the 3-month training program, Professor V. Ganeshan sir, for his session today. And I also welcome today's chairperson, Professor Aradhana Shukla ma'am, and also invite our chief guest, Dr. V. Brahma Reddy garu, and also Dr. S. Vidya Rani garu from a special invitee. So now I request, and I also invite all the participants who have been keenly present, keenly listening or following the sessions. For their, I appreciate their enthusiasm. So I request BG Reddy sir to start the session.
Yeah, good evening to all. First of all, I should invite the 3 months training program chairman, Professor Vedagiri Ganeshan sir, and is also patron of this WCOP, World Congress of Psychologists, and the other two chief patrons and another patron that is from Aran Singh from UP, then other dignitaries of WCOP, and executive committee member. And today I am specially inviting our chief guest, Professor Dr. Brahma Reddy garu, and chairperson of today's event, Aradhana Shukla from also, she is also from Uttarakhand, and another special invitee and other beloved friends. But especially I am also involving in inviting our good friend from Krishnaji from Vijayanagaram, and he is also deeply involved in this Janavijnana Vedika, and our J.P. Lakshman Rao. So once again, I am happy today, and as our repertoire told, today big stalwarts are with us, and we are really happy. We are fortunate to have these eminent personalities today with us. And once again, hand over the mic to our repertoire, Ramadari. Kindly go ahead.
Thank you, sir. So now I invite our chief guest, Professor Brahma Reddy garu. He is very studious right from his childhood, because he stood first in SSLC, PUC, and biological sciences, second in physical sciences, first in English, first in Telugu from Andhra College, and he got a gold medal in his MBBS in 1974 in pre-medical subjects from Kurnool Medical College. So he got trained in surgical faculties from People's Polyclinic Nellore, and established and maintained People's Polyclinic in Kurnool. So he started, his professional career is very interesting. So he did his first open heart surgery in private hospitals of AP, and this was the second place after NIMS in AP. So his permanent pacemaker operation was done in 1989 in the entire Rayalaseema area at Kurnool, and it was the third place in AP after Hyderabad and Vizag. So more than 2,000 heart operations and lung operations were carried out till now, and a very big tumor of 200 kg ovarian tumor was successfully removed from the abdomen from Lakshmipalli, Peddavadaguru, Anantapur district, and done 58 hernia operations in 12 hours period continuously, and which is a world record in 2008. So he has successfully removed 10 kg tumor in from the left kidney, again first time in Rayalaseema area. So he has trained 200 doctors in primary health care to work in villages, and he invented a cheap polythene mesh for the repair of hernia, the conventional mesh of a reputed multinational company with a size of 13 to 30. So, which cost about 14,000. The cheap mesh cost was only rupees 4. So he has trained nearly 300 village youth and women to work in villages in PH, primary health and common diseases, carried out 20 Kala Jatas, health awareness camps by utilizing folk arts like songs, dance, etc. And he has been a very good social activist and science lover, I would say. So he is a chief co-founder of Janavijnana Vedika with present membership of about 20,000. So he served as a convener to the Science and Technology Subcommittee and also for Health Subcommittee of Jana Vijnana Vedika. So served as General State Secretary and also State President. He addressed more than 4,000 meetings on subjects like humanism, rationalism, superstitions, science, health, drugs, provision, poverty, philosophy, education, personality development, village reconstruction, and also trained 6,000 youth in personality development and leadership skills. And he has authored many more books in Telugu only relating to the health to create awareness in the people. So to name a few, Pradhama Chikitsa, Jiva Rahasyalu, Anushastra Vaddu, Anna Vastralu Kavali, Meeru Mi Arogya Samrakshana, Science Every Kosam. So there are many more, and he has also written more than essays which are published in various periodicals and on various subjects. So we heartily welcome you, sir. We are very fortunate to have such a learned person and such a senior person who is very much keenly interested in spreading the awareness among the health and about the science, importance of science in the people. So we are very so hope everyone has understood it. So now I request Ganeshan sir to elaborate it and enlighten us with his experience. Ganeshan sir, please take over.
Good evening, everybody.
Yeah, good evening, sir. Good evening.
Yes. Professor Govinda Reddy Garu and Professor Brahma Reddy Garu and Dr. Krishnamurthy Garu and Dr. Lakshmana Reddy Garu. It's nice, and other participants, and Dr. Sudhagar Reddy Garu, neurologist, neurosurgeon, and dear participants. Communication, as we all know, it happens in two ways. One is verbal, another is non-verbal. And non-verbal communication is maximum happening. 80% of communication happens by the facial expression, hand movement, body posture, etc. So if a person is going to quarrel, the body itself reveals before the quarrel starts. Tightened lips, staring, etc. Okay. And apart from the non-verbal communication, one is known as communication. Ceremonial communication means if somebody hates the other person, the brain of that person emits what is known as the pheromones, which are released on the forehead and also on the nose. And people feel that pheromonal communication is only happening in animals and birds and insects. But in humans also it is continuing, and a lot of researchers are there, but it has not come to the mainstream. So when a person is cursing another person, the pheromones are released, and the other person's nostril picks up the signal, and the other person knows that the person is not being loved or the person is being hated. So how to solve this problem? Because people get irritated, become aggressive, they start cursing the person with whom they have to live. Either the husband has to live with the wife or the wife has to live. And if it picks up, then it leads to divorce. And they come for marital court. Govinda Reddy, being a lawyer, you would have come across a lot of such cases. But judges also, and the law system also says, go for 3 counselings. 3 counselings are recommended with a psychologist or a social worker, depending upon the availability of the expert. Counseling will not help. Behavior technology is required. What to do? If the people are cursing, each other. One is cursing, the other person is afraid. One other thing is, if the cursing has to stop, if the aggressive pheromone has to be stopped, very simple thing is keep the husband and wife together, sitting in the room, sitting closer. Ask them to close the eyes and ask them to slowly breathe out and slowly breathe in. This technique is known as reduction of rate of breathing, which I have already referred in some other case. So when they breathe out, they have to count 1. When they breathe in, 2. Breathe out, 3. Breathe in, 4. Exhalation, inhalation. Count it per minute. Okay, and within 60 seconds, the normal range is 15. That is out and in is 1 pair. So it is 15. But if you ask them to repeat it again, another trial, okay, for 1 minute, again another 1 minute, another 1 minute, 10 times if they repeat in the counselor's room, the rate of breathing comes down. When the rate of breathing comes down, it indicates they are expelling the wasted gases from the lungs and inhaling more quantum of air and oxygen. And that goes through the blood to the brain. And they become less emotional, more rational, more practical. And this will really help. This is one technique which I would suggest to the family counselors to make them to sit. While sitting, they should not sit facing each other. They should face the opposite side, back to back. Okay, because by seeing the partner, they start hating. So if they back to back sitting, if they sit, then they are not, the stimulus is not there before them, neither the husband nor wife. And lower the breathing. Okay, and if possible, second stage or third stage, ask them to keep their back together, back touching each other. Again, reduce the rate of breathing. It will lead to more of acceptance, emotional acceptance of the husband and wife who are considering a divorce, or having a quarrel, or fighting, or using abusive words, and even physically violent. Sometimes people believe that men are violent, okay, but sometimes women are also violent. Whatever it is, they will come to their senses if the breathing rate is reduced. And when the breathing rate reduces, the hatred reduces, the hormonal release comes down, and things will be better off. This is one technique which I would like to recommend in solving divorce cases, provided they are cooperative, provided they come to the family counselors. Next, any other question or observation?
Sir, it's a
Yes.
small doubt. Will this work for the people who have been living for 15, 15 to 20 years?
What is it? Please repeat.
Can we use this technique for the couple who have been living for 20 years, uh, tolerating the abuse and everything, and now they want to go for divorce?
Yeah.
Can we make them sit together and
I would say there is a chip in the brain which is programmed over the 10 years or 20 years or 25 years. Okay, and that is like a tumor. Okay, if more oxygen supply goes to the brain, then that heals. And that is the secret of the technique. Okay. And there are other techniques like in the breathing, there are other techniques like Mahapranadhvani meditation. This rate of breathing reduction is a super technique, but a little lesser than that is, or you can start with this technique first and go to the rate of breathing reduction. But when they do it, they'll be happy because it is just like getting more mark in the examination. When they reduce the rate of breathing, they feel happy. Yeah, I'm able to have a control over my respiratory system. Okay. So as a preparatory, what can be done? This Mahapranadhvani meditation, which is still practiced by the Jain groups. Actually, it belongs to the Hindu religion, but the Jains are more popular with that. It goes like this, a kind of humming voice of a bee can be produced. It is something like this. I will do it now. This is exhalation through the nostrils. And there is a vibration in the throat. When they do like that, then suck in the air, inhale, then again expulsion. Nitric acid, nitric oxide is produced in the nasal cavity when the air goes with the vibration like that, which is very good for health, physical health and mental health. So this technique can be used as preparatory. And then next is rate of breathing reduction. Next is ask them to sit not facing each other, facing the opposite side, and ask them to come closer and let their back stretch. Okay, so when the physical contact comes, then they develop tolerance of the other person. Husband or wife, they accept more. You see, when they sit like this and do it for half an hour, even if they hate each other, due to sheer fatigue, the body starts relaxing. No need for Jacobson's progressive relaxation. Okay, all that, or yoga nidra and all that. So these are quick fixes. Okay, they may not like to touch each other. Okay, if you ask them to face each other, they don't want to look into the eyes of the other person. But back to back touching is not a problem because the stimulus is not visible. And this is why I say you can cheat the brain of the client. Okay, it's an indirect method of modifying the behavior without their knowing. You don't even say don't go for divorce. So avoid speaking. Only ask them to do the exercise 1, exercise 2, exercise 3. The oxygen intake is more, they become wiser. Now they are emotional, they are foolish. Okay. After all, they have loved, they have married, they have children, but they have become wild because of emotionality. And there is not enough oxygen to the brain. Okay. Only the right brain is having more blood, and the left brain, which is logical, is short of blood and oxygen. So this will balance both the hemispheres. So it has got a physiological purpose also. Okay, this is what I would suggest. Yes, please.
Thank you, sir. I will try.
Sir, I am quoting one case.
Yes, please.
See, both of them are medical doctors. When they were students, they loved each other. Finally, they got married. Both are highly intelligent. I am repeating. Why I am repeating means highly intelligent people, including my own classmates, their lives were not successful, particularly as well as marriage life also, including jobs also. Our Professor Basavanna, sir, also used to say, highly intelligent people, their life is quite miserable. He used to pass on the statement. Only average people, they used to shine like anything in life. That's he used to tell now and then. Of course, just if we think our own classmates, how they have settled in their life, if we see, that everybody can check, not only myself. Same thing, whatever Professor Basavanna said and Professor Vedagiri Ganesan sir said is quite reliable, and it has its own validity, and it is purely beyond doubt. Highly intelligent people.
Sure.
Why? Because both are intelligent. So that's why they're successful. Their adjustment life is also simply low.
Yeah. What I would suggest is, if one is a fool, the other person can become wiser. Okay. The problem with brilliant people, okay, intellectually extraordinary people, are their earning is more. The wife earns more than the husband, or the husband earns more and the wife is simply dependent. The major thing which comes, the intervening variable is ego. I am earning more, okay, and things like that. I am qualified more, my wife is illiterate, or the wife says I am qualified more, my husband is only less educated. Okay, this comes And once it comes, the whole biochemistry of the blood changes. That's the whole problem. And what is love? Accepting the other person. Okay. But here they are loved once upon a time. Then afterwards, after the marriage, when everything is stabilized, after marriage, the contact is very sure. They start kicking each other. That's a problem. They should not kick each other. Okay. They will be kicked back. Okay. And it becomes more exciting. Like World Wrestling Mania, they give a punch, the other party gives a punch. Baba, this is the whole fun is lost. Okay, and they keep away from sex as if they are going to deprive the other party of sex. It is not like that. You are missing the pleasures of life, and you are telling that you are depriving the opposite party. So you are full of an ass, because we do not know life is not permanent. Anytime you will leave, or the wife will leave. So make use of the present life as if you are going to die tomorrow. What will you do? Will you quarrel all the night, or will you love? So some of these cognitive things are also required to make them to love each other. And if at all there are problems, I will simply ask them to list down what do you want your husband to do, what do you want your wife to do. Make a list and make it longer and longer. 10 items, 20 items, 30 items, and exchange the list between husband and wife. And it is just like treat the wife as if she is the goddess, and treat the husband as if he is the god, and ask them to tick few things like what you call as a boon. How many boons you can tick and grant? What the wife wants or what the husband wants. If you start ticking one or only one or two things, 7, 8, 9, 10, make it 11, 12, 13. You list all little things. Okay. Once they start opening up, they start communicating. Once they start communicating, give this list to the wife's list to the husband, husband list to the wife, and ask them to start giving the boon. If they start saying, ticking one or two, they are ready for a kind of agreement. Okay. And later, certain things they will simply drop. Within a week, they will drop. Only thing is you have to treat them continuously, because this is a serious case. Don't ask them to go and come back later, as per their convenience, as per your convenience. So it should be like a case treated in IC. Every day they have to come. If possible, you have to spend the whole day with a couple. So it is just like admitting and treating. They always believe in admitting and treating than to have sessions after which they will go away, because the effect will dissolve. So the inpatient facility like that, we should treat the intensive behavior therapy, which will help. Okay, because you are a person, you are a referee managing these two opposite persons. Actually, men are different from women. Okay, they've got actually they are considering now at international level to have a male psychology department and a female psychology department, and sleep by males and only with females. Because the way they think and feel and experience is entirely different. So it is difficult. The department, female psychology. Doctors also they specialize, like pediatrics, like orthopedic. It's a male psychology. They will understand better. They will study. So that is the future of counseling and psychology. But we can empathize. But even as a male psychologist or a female psychologist, we can empathize. With our long years of experience, we will be able to empathize. Okay. So that is it. And there are techniques like, as we have already discussed, role play, role reversal. The man plays the role of a woman, the woman plays the role of a man, husband and wife, they exchange, then they develop the language, the body language, etc. Then they understand, the man understands how it feels to be a woman. The woman understands how it feels to be the husband. And that can be also done. So it is an intensive program is required. It is not just giving a relaxation and leaving them to go, or just giving them the advice and talking about ethics. All those things it will not work. Because the brain is quite confused. Okay? And they have programmed it with a negative feedback. So that has to be diffused. It's just like a time bomb clicking. So something has to be done to diffuse it. And the legal fraternity should take care of it. They should not take the case further for court. They should send first for psychologists. And the courts are having their own counselors. It is not enough because they are overloaded. So they should have a list of counselors in the area and refer them to different counselors, family counselors. Okay. So that is what I would suggest. Yes.
So I just conclude the case which I have explained. Finally, what happened? Both are highly intelligent. They loved each other when they were classmates. Then they produced 2 children also happily. Then finally one day this gentleman has passed one negative comment against, and both of them are writers. And this gentleman has passed a negative comment against her writings, and that made her the family to go for divorce. It's funny, but interesting. But no counseling as successful, and no mediation, no conciliation, nothing. Just a word from a negative word from
Okay,
a
that's all right. Not all the cases are successful, but we can learn from why it is not successful, and the next couple we can treat. So what I would suggest to such a case, I will simply ask the husband and wife in their presence, both together, sitting before me, tell me 3 good things about your husband. And I will ask the wife, and the husband also say 3 good things about your husband. They will go on thinking for a long time. Then they will say something which is not a good thing. It is a mixed thing, plus or minus. As they know, filter it. Say only a good thing in your husband, good thing in your wife. Then they will find out one. Go to the second and the third. So the cognition keeps shifting from negative to positive by this simple technique. 1, 2, 3. Okay, 3 they have said. Then turn to the husband, turn to the wife and say, you are smartly dressing. Or he will look at the wife and say, you are good looking. Okay. And things like that. And then he will say, you are a very good cook. Okay. He will talk to the husband and say, your language is too good. You are able to write poetry like that. And it pacifies the relationship. Then I will say, go to the 4th, the 5th, and 6th. Then they come closer. Okay. That is one technique. They cognitively accept the positivity. Otherwise, they are focusing on the negativity. Okay. Something like that. So that is also another thing. And as I have already mentioned, sex is a major role in communication. That I love you, like that. Okay. Giving food is also love. Getting dressed is love. Touching is love. Kissing is love. Maximum is when they enjoy. Okay, orgasm is there. That is the reinforcement. Then the bondage is okay. But unfortunately, many of the psychologists do not dig into the sexual competency of the person. Some women do not like sex. Some men also do not like sex. So both of them have to be empowered. Once they are empowered, they are happy. Otherwise, they have been, for example, they have lived for 20 years, 1 or 2 children, but sex life may be 0. So it has to be recouped again. whatever be the age is not the factor. Even 60 plus, 70 plus, and what is sex is not population. It is sitting together and holding the hand and leaning on each other itself is sex. And women get excited even with the touch. Okay. So man also gets excited to be hugged. That is enough. It may not lead to penetration. Okay. The massage, the hugging, holding the hand, leaning on each other, that is enough to excite. Okay. That is why I said back-to-back touching without seeing. Don't see, but sit facing the opposite side. Don't look at your husband or the wife, but lean on them. Okay. And the next step is push the person. And you ask the other person also to push. Push, 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 push. The whole thing becomes a play. When it becomes a play, the negative emotions are lost. They become playful like children, like a tug of war. Girls pulling and boys pulling, and then what is it? They forget. Okay. So they are very simple, interesting, creative ways. Okay. Rocking, rock, 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 rock. Put on some music, rock, rock, rock. Okay, there is a distraction. They forget who is that person sitting at the back. Is a wife or husband, they forget. They're rocking. It distracts. Okay. That is how I cheat the brains of the clients, because it has been doing all nonsense. So it has to be changed. Okay. If the coffee is bitter or tea is bitter, put some sugar, then it becomes all right. So there are ever so many creative ways of bringing people together. For example, two boys are quarreling in the class. What the teacher does in the primary school or secondary school, shake hands. The touch happens. Touch itself is therapy. Then they become little friends. They may still fighting, but then not so ferociously as before. The school teachers know that. Okay, like that. So it is all, I leave things to the problem solving capability of the therapist. Similarly, surgeons also, the styles vary. MDs also, the styles vary, because they are so much involved and they develop new techniques, either in surgery or medicine or in counseling. Okay. Ultimately, the goal is to make the client become all right. Okay.
Yeah, I think we have covered more than two cases. One is just loving each other, highly intelligent people. That such people also just which I presented. That one becomes another case. Another case is highly egoistic. As our professor said, people, the women are earning more and they are highly egoistic. Under those circumstances, there is every possibility they are more prone for just going for divorce. And particularly my question is, I'm just simply, if it is, if you think it is a question, if it is not, it is a clarification from our Ganeshan sir. Older days, just elderly people, they used to speak less and their non-verbal communication, they used to give more priority for non-verbal communication.
Yes.
Why? Because this much of facilities as far as houses are concerned, particularly villages. See, joint family system, 3 to 4 brothers, they used to marry each other and they used to live in a single, what can I say, house. But those days, there is no possibility for exhibiting their own communication, only body language, their role, they used to apply more body language. And they're highly adjustable also. But now, today, just each individual, they have constructed a big houses. But what is the use? No communication, no proper communication. And if at all there is a communication, they used to just argue each other, fight each other, and whatnot, everything. And I already quoted one case, and both of them are gazetted officers. This case also you can quote right down. Both of them are gazetted officers. And they have accidentally 2 children. One is a daughter, elderly, and another is a boy, just is a young boy. See, all these two people, and the opposite people, they're highly cooperative towards this family. And as I told, they are registered officers and they are highly egoistic also, as our professor said. What happened? Here, communicating what so far Ganesha sir said, communicating each other and just touching like this is love. But no love, nothing doing that. No communication, no touching, nothing doing that. This gentleman bedroom is separate and TV is separate and food eating also separate. And the house was just maid. She used to supply everything. That is the communication. Subsequently, worst people are the children. And the girl got married and she's okay. And another boy, he just got married and is a bank officer. He just goes to the bank and his communication will be very good with all his colleagues. When he comes back home, everything is quite miserable. Because of this, just no proper communication, no understanding, no love each other. So it reflects on the adjustability of children. So luckily that girl got married and they are living happily. And in this case, this boy, and even their education also like that. And they used to lock down and keeping these two children inside. And they used to open the windows and they used to watch like dogs watching when we leave them in the house. So that was the protocol, no communication, no adjustment. And I saw many cases, they in front of the gate, happy home, but no happy inside of the home.
Okay. Now, I would like to say some suggestions with
Please,
regard to the ego problem, which comes out of money. One is more salary, more income. That is one thing.
Yes.
Another thing is I am more qualified than, I mean, sometimes women are more qualified marrying a person who is less qualified. Okay. For both the things, they are egoistic. As I usually say, how to dissolve the ego. One is prayer, but some people do not pray. The second thing is charity. If the husband feels he is earning more than the wife or the wife is earning more than the husband, ask the wife to donate. When she donates, she cares for others. She doesn't care for the husband, doesn't care for the children also. Because I know of a IAS officer, both husband and wife, having only one daughter. And she was very attractive and she was doing MSc, MPhil, etc. The mother was quarreling with the daughter and telling, do you think you are more attractive than me? This is the mother. Mother would have been attractive when she was a young girl. But this daughter is a young girl and she is challenging, are you looking more attractive than me? So she is not mentally okay. And this girl, daughter, tried to strangulate the mother. So she was afraid what is going wrong. They don't want to go to a psychiatrist to be branded as a mad girl. So they brought the case to me. One simple technique. She was not playing the role of the mother. Okay. I asked that lady, IAS lady who was the commissioner of income tax, to sit on the bed, and I asked the daughter to lie on her lap, keeping the head of the daughter on the mother's lap. The daughter started crying. Mother also started crying. That communication is non-verbal. They started hugging each other and patting and things like that. I have not told you. You are only feeling like an officer, an IAS, and the commissioner of income tax. And you are treating her as if she is a stranger. After all, she is your daughter. But if I talk, she will not understand. So I usually believe in not prescribing, not talking, but prescribing behavior. Directing, like I was curious what is going to happen. I asked the daughter to lie on the lap of the mother. I left them and went out of the room. The girl started crying and mother started crying. They started hugging each other. After 15 minutes, I entered. Things are okay. But if you ask them to show love, they will not. Okay. So this is possible. Another thing, whoever is earning more, ask them to do charity. Okay. And as a Rotarian, you can ask them to join Rotary. They will know the taste of charity. Okay. Then they will find what they can do, how to give polio drops or wheelchairs or the handicapped or the destitutes home, etc., old age home, etc. Then they start melting. Otherwise, their heart has become like a rock. It has to be melted. You can't do it by verbal communication, but by action. You have to engage them in acting. Okay. And that will bring a lot of changes.
Participants, please, from participants' side, I am just expecting at least one question, one clarification. Please see here, 3 months play or 2 months play. Myself, rapporteur, or somebody else. Ganesan, sir. What about just you're all matured people, learned people? Come out. Just you ask at least clarification. Please.
Yes, sir. I am ready here.
Yeah, please, sir. Please. Welcome.
This is more a question to Dr. Brahman Reddy Garu, as a medical doctor, a problem. Usually, the person who gets fits is being helped by the neighbors or the attendants by putting some sort of keys or any iron piece in their hand or in the mouth to reduce the intensity of the fits. And subsequently, the person gets all right. How does it work? Is it something to do with the electrical transmission in the brain? Am I clear about it?
Yeah. I think the question is for the neurosurgeon. I think he may answer it, or I can give an answer later.
What any iron piece or keys have to do with the treatment?
Yeah.
Yeah, I think along with us, Sudhakar Reddy is there.
Yeah, is he there? Or
Yeah, he's there. He's there. Sudhakar Reddy Garu.
Yes.
Yeah, Sudhakar Reddy Garu. I think have you followed the question raised by our JV Lakshman Rao sir?
I know holding keys on the kids. In many villages. Actually, the explanation is really doesn't stop fits. The fits normally they will stop by 1 minute of time, maximum 2 minutes time. Any tonic chronic seizures, their time is only 1.5 to 2 minutes time. And villages they keep chain in the hands and they wait for 2 minutes and naturally stops normally, and they think it is in the palm of the hand. Otherwise, it has no connection to stop fits in the patient. And the most important thing is prevention of complications during fits. Patient should be in the lateral head down position to prevent saliva to drain down and die. And people should not block there, preventing the oxygen going to the patient. So there should be fresh air. They should not block the people, and the patient should be kept in the lateral position, the left lateral, right lateral. Left lateral is more convenient, and head should be and prone. This is called coma position because the saliva, everything will drain down, is very important. Otherwise, it will go and choke the larynx, and the patient will die. And that is how this patients will die because of the saliva going and choking. So that can be in this position. and keeping the keys in the hand has no relation to fits at all. And it is in the International Epilepsy Association also explained in one comments. So that is the explanation, Lakshman Rao garu.
So the electrical discharge because of the iron or metallic things put in the person's mouth or in the hand.
Yeah.
Oh, is it?
Actually, electrical discharge will not prevent the electrical discharges in the brain. Actually, the duration is 1.5 minutes only. Any fits, generalized tonic-clear seizures, and they keep the keys in the palm of the hand, and they keep on waiting for 1.5 minutes. It stops automatically, and they think it is because of the keys in the hand. It has no direct relation in preventing seizures in the brain. But most important thing is prevention of complications during fits, that is aspiration. So keeping position, data position, head position is very, very life-saving procedure, and it should be taught to every person in the villages or so keys actually scientifically they explain it has no relation in preventing seizures. That is the explanation, Lakshman Rao.
Thank you very much for
One technique which will be
clarification.
neurological discipline.
చాలా సంతోషం అండి. I got some answer from you, and it looks it is reasonable.
Yeah.
Okay. Now, what I suggest
These practices are done only in the villages. Of course, cities that nobody cares if a person is suffering from fits or something on the road. They leave him and they or put buckets of water. They put lot of water on the person, though he is kicking.
Yeah. That is very dangerous, sir.
It is not good.
It will cause aspiration and death also.
Yes. Because the water will go into the lungs.
Yeah, exactly.
Yeah.
They put a lot of water on the person so that he gets perhaps a sort of shocks.
Yes, sir. Actually, in Tirupati, we have Indian Epilepsy Association. We have got Tirupati branch. I am the secretary for that, and we have actually launched some training programs. Some people here in Tirupati, how to prevent complications during fits. First complication is aspiration, and prevention of this water pouring, and it will lead to death also of the patient. Most important thing is the tongue biting. You should prevent biting of the tongue by keeping one wooden or even kerchief between the teeth, so that you can prevent biting of the tongue and bleeding from the tongue. And allowing the more air, blocking all people around him will cause hypoxia to the patient. So mainly four things. That is no aspiration, keeping the lateral position, head down position, and keeping one wooden or anything piece between the teeth, prevention of the tongue biting, and more oxygen should come to the patient, and don't pour more water on the patient. These four things should be prevented. And in our Indian Epilepsy Association Tirupati branch, we have connected some these programs to teach the people in Tirupati, and we have become successful.
I think some sort of like CPR, some training has to be imparted on some of the people.
Yeah, that is TB of the brain. That is the pathology of the brain. It can lead to focal seizures becoming generalized, depending upon the location in the brain, tuberculoma of the brain. TB meningitis directly will not cause fits, but because of the post-meningitic hydrocephalus can lead to seizures. So that we can treat with anti-TB drugs and steroids and treat the pathology. That pathology also can lead to fits. There are so many other pathologies which can lead to seizures. Okay.
What would be the main cause for that?
Main cause is the disturbance in the brain, electrical disturbances in the brain. Either idiopathic, that is no organic or no pathological cause, idiopathic with generalized seizures, where if you do CT scan or MRI scan, there will not be any tumor or tuberculoma in the brain. Brain will be normal. That is idiopathic. Other things are commonly due to some lesion in the brain, either in head injuries, post-traumatic seizures. Head injuries, any hematoma in the brain will lead to seizures, or tuberculoma in the brain can lead to seizures, or any these parasites like Circus also can lead to the seizures. And there are other pathologies like brain abscess from CSOM in the ear discharge. You can go to the temporal lobe and lead into abscess, and that abscess also can cause seizures. So these are the common causes that can lead to seizures. If you do CT scan or MRI scan, you can really locate what is the exact cause and location of the lesion, and we can treat accordingly. If it is tuberculoma, we have to treat with anti-TB drugs. And if it is hematoma, large hematoma, we operate and remove the hematoma. If it is an abscess, we go ahead and remove the abscess. And like that, now because of the MRI scan and CT scan, we are able to pinpoint the diagnosis and treat very efficiently all the causes of fits. And without all these causes, the generalized seizures are there. We also can be treated with anti-epileptic drugs.
Sometimes children have this sort of difficulty, but as they grow, I think they become all right. How does it happen?
Yeah, children, actually, during the delivery, if there is a long duration of delivery or head not coming out of the pelvis taking long time, and there will be hypoxia to the brain. This is called birth anoxia. It is, nowadays, all over India, it has become a big issue, leading to mental retardation, cerebral palsy, and spasticity. There is one spastic society in India. They are concentrating on prevention of this birth anoxia by giving very good obstetric care. And all the pregnancies should be hospitalized and should be under gynecological care, so that you can prevent this prolonged labor or birth anoxia. So once you have birth anoxia, there will be seizures for the child if there is hypoxia to the brain because of birth anoxia. So those seizures will be controlled by the anti-epileptic drugs. And also,
Is the forced delivery is advisable in that such cases, or cesarean only?
nowadays, nobody is doing forced delivery. They are going for cesarean section. I support cesarean section is prevents all these complications. If there is a delayed labor, prolonged labor, or difficulty of head coming out of the womb, directly please go to cesarean section. It prevents all these complications. So this forced delivery nowadays nobody is doing. So when I was house surgeon, we have done forced delivery also. That leads to some trauma to the brain by extraction, by holding the head and extracting, will cause pressure on the brain, leads to seizures afterwards. So nowadays nobody is doing forced delivery. So if there is a difficulty, go for cesarean section, do a safe delivery, and prevent all.
Thank you very much. Thank you for the clarification, because in such cases, cesarean is better than forceps.
Now, I would like to suggest one technique, which is known as a reverse control technique. Because some of them may be malingerers. There may not be any organic cause, but still they may be manipulating their family by enacting as if they are having a seizure. That is one thing. There may be a functional cause, not organic. In such cases, what is required is we will ask the person to act as if they are having the seizure, because they are unaware what is happening, their hands and legs twitching and all that. So those who have observed, like parents, they will enact what happens by seeing that the client has to act like that. So the therapist will say, start. Then they will start twitching the body in a particular way. And the parents will give the correction, not that way, this way. Then the therapist can say, stop. Again say, start. Then stop. 10 times, start, stop, like that. That is the first set. Next, the client himself or herself will say start and then start twisting the body. And the person will say stop
Breathing
and
exercise.
stop it. It is enacting the sequence. And it starts with the skeletal-muscular activity. Again, it creates electrical impulses in the brain. When the brain gets electrical impulses, the muscles start moving. So by doing like this also, this is what can be called as a reverse control, and they will come out of it without drugs, only with the behavior prescription. 10 times as per the instruction of the therapist. Start 10 times. Then the patient herself or himself will say start and start acting and stop 10 times. Okay. And repeat it for 1 week. And the fits will go. I have treated such cases with this technique. This can be tried. Okay. Because this becomes a block for marriage. A girl cannot get married.
Yeah, exactly.
Or a man also is hesitant to get married. Okay, so it is better to treat like that. Even after marriage, the fit comes, whether for the husband or wife, this technique can be given. This is my suggestion.
After certain age, I think the people also get adjusted and they improve their brain function.
Yes, yes, yes.
Thank you. Thank you very much for both of you giving me a clarity in the problem that I have seen in the mostly in the villages.
Yes.
I have a question, sir. Good evening,
Yes,
sir.
let's say yes, good evening.
Yeah, so get here. So I have this client who is a pilot, sir. He's been running Air India for like quite long time. He's a
Okay.
very early pilot now. He's like 60 plus.
Okay.
And he has 2 sons who are like who studied abroad, and one is at home, one is still studying abroad. And he has got a wife who is like not educated much.
Okay.
She doesn't even know English, kind of thing.
Okay.
So what happens is he keeps her always in her place, always shouts at her. The problem is, if he starts shouting, it goes on continuously for 2 hours and plus.
Okay.
And this happens even with children. Even if they're going somewhere, he'll call them, make them sit on the sofa, and then he start shouting. The thing goes on for like 2 hours. It goes like through the day, many times a day.
Okay.
It happens with wife or son or like anyone. And one more thing is, he's very suspicious of his wife. They have like around 10 servants at home, gardener and all of them. But he suspects her with everyone. And she's like bound to the thing of her home. She cannot even go out. Even she cannot. She says, I can't even assign work to my servants because he's suspicious.
Okay. Okay.
And
Now,
she
you can do
always,
1 or 2 things.
Yes,
One is use in the cell phone, voice recorder is there.
yeah.
Voice recorder.
Mm.
Okay. You record his voice when he is scolding
Mm.
and replay the voice.
Okay. Mm.
When he listens, his scolding
Okay.
will stop. It is auditory feedback. It is a stealth technology. Without telling him, you ask somebody to record whether his wife or son or whoever, okay? And call him for the counseling center and replay and say, this is what you are doing, and then try to regulate it. That itself will help. That is one thing. Another thing, he is a pilot and he is traveling throughout the world, and he may have extramarital sex. So key things.
Definitely, sir. He has all the habits. The thing is, he drinks, he does drugs, he smokes, and he also has women. Not now, maybe, but he had it. And the problem is, when sons do the same, he gets very irritated. He's like,
he will tell all the story, romantic story to the wife also.
wife is quite helpless. She's so powerful.
There is a saying in the villages.
So you're not audible, so I'm not able to hear.
Ganeshan sir, your voice is not audible. Ramadevi?
In
Yes,
Telugu,
sir.
okay. Are you able to hear me?
Yeah,
Now,
now,
it's
sir.
okay.
Okay.
Yes, sir.
Now.
Upukadandi Upadesam. One person was doing Upadesam. Okay, he was a religious person. Kadakalakshepam he was doing. And he said one has to live properly, ethically, and all that. Then he went to a prostitute's house and banged the door. And she said, "You have talked like that, and now you are coming to me." He said, "Urukku dandi upadesam." Upadesam is only for others, not for
Right.
me. And that is what the pilot is doing. But tell
He's
the
very
pilot,
confident
you can
about
tell.
what he does, sir.
No, it's okay. You are the counselor. We have the power. First of all, a family counselor should feel as if you are having a professional power, like a doctor, like a surgeon, like a specialist. You tell him, can you satisfy your wife and create multiple orgasm for your wife? He's 65. Okay, what happens is you would have had relationship with air hostesses or prostitutes. They are not bothered about orgasm. Okay, but tell him, reduce an orgasm to your wife, single orgasm, then double, then triple, then he will calm down. That is the solution. You speak
Okay. If they are capable, I'll ask them to do
don't
it.
hesitate because you are young and you are a girl, but you are a professional. Yeah, he is not capable, I am telling you. If he is capable, he will keep quiet. He is not capable of producing multiple orgasms.
Maybe. Yes, sir. And these
Not
children
because
are
of his age,
really
because of his
frustrated.
premature
Children are
ejaculation.
really frustrated with the space.
You treat this guy, don't bother about the children.
Mm.
He will become all right. One is audio feedback of his aggressive
Okay,
words. Second is,
Mm.
tell him, can you produce a single orgasm for your wife?
Mm.
Okay, then you interview the wife separately. Did you have orgasm? Okay, then ask him to create double orgasm, 1 and 2, and then 1, 2, and 3. Then he is going around with other girls will also stop
Mm.
because he has no control over his erection. He is having premature ejaculation. That's the problem. And such people only shout at wives because they
But
want
what
to.
could be the reason why he's shouting at children, sir?
No.
Frustration. It should
He
be.
is threatening the wife to be away. She will not ask for sex, orgasm. But that way, he has to shout with everybody because he is the breadwinner.
Mm.
Sir, you're not audible, sir. Ganeshan, sir.
Ask him to donate. How to shrink used shoes, socks, whatever, belt. So if he starts giving, then arrogance comes down.
Right. Mm.
So it is a very simple thing. Suppose so they used to release the air, then it goes smoothly. So when ego is there, the life is hell for them and for others. Okay, how to release the air? That is the technique used in cars. Okay, so that's why they have a meter which says how much is the pressure in the car. In the
Right.
petrol, they give, and then if it is little more, they will release it.
Mm.
So one of the way of releasing the ego is to make them engage in charity, and they may not like to give money. Okay, but ask them to give used clothes, used utensils, okay, anything. Ask them to give it to you, you give it to somebody else. That's what I also do. I collect such things and give it to people, poorer people. Later they can, themselves will give. The whole problem is ego. It will lead to physical problems, psychological problems, mental health problems.
So what should the children do when confronted with this thing? Though wife is used to his ways, children are
Yeah.
really irritated and frustrated.
Who is speaking? I'm not able to see.
Sir,
Who's
me,
speaking
sir.
now?
Same, Getsy, sir.
Betsy.
Am I audible, sir?
Okay, but your photo is. Yeah, I will tell you now. The children have to imagine that the father is having a head of a donkey.
Okay.
Holding, when he is holding, or a buffalo, okay, or a bulldog, or a Pomeranian, okay, and audio also replace, video also replace, then nothing will affect. It's a cognitive technique.
Right.
Okay, you ask them to do it. I asked even the school children to do it when some harassing teacher is there, or the wife is being harassed by the mother-in-law or the husband, or the wife is harassing the husband. Simply look straight, but start imagining. Okay, we say full of an ass, but instead of saying full of an ass, imagine that they are having the head of an ass or a goat.
Actually, I did try this technique, sir, with one client, and she was like, helped. I asked her to
What's
imagine
happening?
the face.
Does it work?
Yes,
It
she
will
said
work.
she was laughing actually. She was
It
laughing.
will work. Yeah, now, first of all, I will ask the client to replace my head and my voice. I ask them to replace my head and the voice. They do it because they don't care. But when they meet the husband or the father, they cannot do it because they become jittery.
Right.
So they become playful with me. I say, do it. Okay. And they will do it.
Right.
Because I'm only asking. Okay. I'm only volunteering them to imagine. That's it. Okay.
Thank you, sir. Thank you so much, sir.
I should also thank Getsy Salman because it is time to wind up the show. We are waiting for your conclusion. Are you happy now?
Sir, I'm done. Thank you so much.
If
Good
anything
night.
is there, we can continue at next session. Sir will be available. Okay, fine. Now,
Okay, Betsy.
Thank you, sir.
now Rama Devi will conclude. And before Rama Devi brief vote of thanks, now I request participants. Say, I think you are in touch with writing down the records and submitting to the course coordinator. Please do, and just we have been uploading the see all the videos of particularly when practical sessions started. I think you are in touch. You are just with that work, I think. So successfully, you may complete it and send it to Professor Ashok kindly. Right now, our Ramadevi will finish it. Just go for a very, very brief conclusion. With thanks.
Okay, so that was the end of another excellent session, an educative session. It's regarding the conflict management and how to resolve the egos in between the couple. So that was really wonderful, sir. Actually, I have a case, but I will talk in the other session because I have only information from one side. So I'll take up the session in case in the next session. So finally, I would like to thank Professor Ganeshan sir for his valuable time and interesting techniques, I would say, for raising the good point.
Thank you very much.
Yeah, with the permission of the Ganeshan sir, next topic will be on single parent and influence on children. I think I request all the participants at least you should come along with a simple case at least. Okay. With all,
Okay.
again, once again, thanks to our Thalaivar, our Ganeshan sir. Good evening. Good evening to Lakshman sir. Good evening to everyone, all participants. Good evening. Good day.
Thank you.
Good evening, sir. Good evening.